welcome everyone to our webinar on the resilient transformation of public transport in Greater Boston. Today, we'll explore the innovative tactical interventions that emerged from years of different challenges, including the pandemic, from pop-up dedicated bus lanes to free fare trials, fostering lasting change and hope for a thriving transportation system. So with that, I'm very happy to introduce today's panel, starting with Julia Wohlers, formerly ITDP, and now Assistant Director of Transportation at the Boston Metropolitan Area Planning Council. Julia will give us a bit more insight on the bus evolution in the region and then moderate the discussion. Hi, Julia.
Hello.
And then we have three exciting panelists. First, Jay Monty, Director of Transportation and Mobility at the City of Everett, Massachusetts. He'll give us a snapshot on Everett and some of the activities leading to permanent bus solutions, followed by Wes Edwards, Deputy Chief of Operations, Planning, Scheduling, and Strategy at the Massachusetts Bay Transportation Authority. Wes will give a brief background on the MBTA's bus service and share some of the challenges and successes in delivering the rapid response bus lane program. And finally, Ann Lin, Director of Planning and Narrative Strategy at Grayscale Collaborative, who will talk about the inclusive planning and equity aspects in the example of Blue Hill Avenue Transportation Plan. So with these lengthy introductions, I'll pass it on to Julia.
Thank you so much, Simona. My name is Julia Wohlers, as Simona said, and I'm a former ITDP staffer, now with MAPC, the regional planning agency here, and I'm very happy to be moderating this exciting webinar today, not just because it's a reflection of how I spent the last 5+ years as a former program manager for the ITDP Boston office, but because it brings together a collection of minds from across the sectors who have all contributed directly and indirectly to the ongoing transformation of Greater Boston's bus system and the streets, infrastructure, and people that support it. Now, let me just say, transforming a bus system or a bus service isn't just about making buses faster, getting them to show up on time, or giving them fancy new vehicles, although those are certainly important elements. It's about making it nimble and responsive and able to adjust to changing needs and demands of its ridership based on the changing conditions of the time, and able to do that quickly in a timely manner. Here in Boston, or Greater Boston, I should say, it's a big region of many municipalities that rely on one transit agency largely. Our bus system has been put to the test numerous times over the last 5 years as the COVID-19 pandemic turned mobility and public safety on its head, and then a series of service shutdowns and disruptions have taken place to enable critical infrastructure repairs. These disruptions, while challenging, gave transportation planners an opportunity to demonstrate just how powerful the bus can be during times of crisis, how things like service adjustments and pop-up dedicated bus lanes and listening directly to the people who ride and drive the buses can effectively keep moving people to where they need to go and ultimately keep the regional economy running. And even without a crisis, like a public health pandemic or failing subway infrastructure, Greater Boston has seen over the last 5+ years a wave of momentum towards prioritizing buses and the people who ride them as more than an afterthought, and making changes to the streets and to the public process to reflect that. The Boston BRT initiative, which has been managed by ITDP, played a pivotal role in cultivating and growing that momentum, first through data and research, then through tactical demonstrations and partnerships with community-based organizations, local artists, and other creative stakeholders you might not normally see as part of a transit project. The results, I think, and I think you'll agree, have been impressive and have effectively set the Boston region on a path to planning for a bus system that moves people safely, quickly, and reliably, and that is able to respond to the needs of the people it serves, particularly in times of crisis and disruption. In today's webinar, as Simona said, we'll hear from 3 speakers who have all contributed firsthand to strengthening and innovating around Greater Boston's bus system, most of which, I must emphasize, is still underway. You'll hear how seemingly small interventions like a pop-up bus lane or a fare-free pilot have effectively moved the needle towards incremental changes throughout the system that collectively add up to a widespread transformation. You'll hear from a municipal transportation planner who spearheaded the region's first pop-up bus lane in 2017, coining the now familiar term, the pilot as a public process, big fan of that one. A leader within the region's transit agency who oversaw the rollout of demand response interventions during the pandemic shutdowns, and a consultant who has helped bring historically marginalized voices into the process for projects like these. So without further ado, I'm going to hand off this presentation to our first speaker, my friend and colleague over in Everett, Jay Monty.
Thank you, Julia. Pleasure to be here and pleasure to have all of you here. Julia and I go back quite a ways now, from really almost the beginning of our pilot process in 2017. So I'm going to give you a quick rundown of the city of Everett and what we did and the lessons learned. And I'm going to share my screen here. Just give me 1 second. Sorry. There we go. Okay. So we're going to talk about, tactical interventions in transit. And, Everett was really widely seen as one of the first communities in the Boston region to use this sort of pilot as a process, pilot project as a planning process. The notion that there are interventions we can make in our transit system, and not just the transit system, but perhaps our streets in general, where the city, the mayor, the staff are willing to take a risk to try something that is maybe not in concrete, maybe not a major infrastructure project, but to take a risk to repurpose, in this case, part of our street. And rather than engage into the traditional long-range planning process, try it out, get feedback in real time, and use that information to inform future decision-making. So a little bit about Everett. We have a population of about 50,000 residents. We're relatively small area-wise, only about 3.5 square miles. And we're only about 3 miles from downtown Boston. And for those of you not from the Boston region, one important thing to note about Boston is that Boston proper, particularly on the north side, downtown is right at the north end of the city and is surrounded by numerous other municipalities, Cambridge, Somerville, and swinging around to the east here, Everett, Chelsea, and Revere. So we're very close. We have a lot of transit-dependent riders. We have a lot of bus routes, but notably we don't have any rapid transit. We don't have a subway. We don't have a train. So folks here really rely on bus service. And when I started this role in 2015, that bus service meant local bus service, stuck in traffic, frequent stops. It was a slow and long trip for our residents to commute into the city to their jobs. So early on in my tenure here, we did undertake a study with the State Department of Transportation, Mass DOT, and really tried to identify where the shortcomings were in our transit system, where our needs were, the changing demographics, really a typical type of planning study. But what we asked our consultant and MassDOT to do is actually give us action items that we, the city, could undertake immediately. I think the fear was, plans sit on shelves, right? Plan is only as good as the things that get implemented afterwards. And knowing that some of these recommendations in this plan were things like a true bus rapid transit service, a commuter rail station, things that we knew had a long time horizon, we wanted to be able to make some instant actions to improve the experience for our residents and our transit riders. And so one of those was dedicated bus lanes during peak hour. And this was really done over the period of about 2 weeks. We sat down with folks at the T. We sat down with the mayor, Mayor Carla DiMaria, who's been mayor here for 17 years now. And we said, hey, you know what? We don't know how this is going to work out, but we want to find out how it'll work. And can we try for a week to cordon off a lane of traffic, run the bus through it, and see what happens? And it really was intended as a couple-day pilot. It was intended as 5 days, and we would take some data, and that might inform some future long-term project. But it wasn't intended as a long-term plan. So we put up the notices about 3 days prior. I went out there with our DPW crew, and I marked out on the street with them location of orange cones to mark the lane. We didn't actually have any paint on the road that could be used to define the lane. So we went out with cones early that morning, and some sort of makeshift signs, and off to the races we went. And kind of shockingly, we got a lot of attention and a lot of feedback. We weren't expecting this much feedback. TV stations, newspapers, and we did have folks from the T who, quite graciously rode the buses that week and took surveys of the riders to find out, how were they experiencing this. And bus riders we had known were hard people to get to evening meetings, or hard to sort of, unless you meet them where they are, right, on the bus or maybe at the stops, it's hard to get their input. So we rode the buses and we took surveys and we found out what their feedback was. And what's interesting is we like I said, had about a 3 days notice before we did this. We announced it in the paper the week before on a Thursday, and we ran the pilot on a Monday. Between Thursday and Sunday night, we got calls from city councilors, calls from business owners, all with very negative opinions on what we were about to do. But by Tuesday, Wednesday afternoon, we saw this, and we saw a very stark change in attitudes about how the pilot went. And I think this is really telling, right? Because we often, as planners, ask folks to for their opinion for things that they haven't yet experienced, right? And there's sort of a natural sense of fear of change that I think comes out in our planning processes. And so what we did here by running this pilot was to say, look, we want your input. We absolutely want your input, but we want it having experienced that change, right? And so a lot of those fears that somebody's business was going to get ruined because they didn't have the parking space in front of their on their curb for 3 or 4 hours in the morning didn't come to pass. The traffic concerns didn't come to pass. So having folks experience things in real time as opposed to sort of what might happen produced a very, very different result. And I think changed the attitudes of a lot of us who plan infrastructure and plan transit and our streets in the region. So we were out there putting out cones for better part of 8 months. And the next year we came back and we put down paint and the red lanes and put in the new lane markings. And that was now 8 years ago. And we continue to run this service. We've expanded the lanes. And about a year after we ran our pilot, Boston in their Roswell Mill neighborhood ran a similar pilot. Similar results. And I think the trend has been that these types of interventions are doable on short notice with sort of real-time feedback, and they're certainly flexible too, right? If this hadn't worked out on day 1 or day 2, we could have not done it on day 3, and there would have been no cost, really, no long-term impacts. So really, this is about being flexible. Listening to your constituents in real time in order to affect change. So Julie jokes I coined the term the pilot as the process, and that really came about. I was talking about this project for the first time in front of a bunch of advocates in our region, very well respected advocates who, but folks who really are passionate about engaging the community and getting feedback and doing a very comprehensive planning process. Folks, I was afraid we're going to look at what we did and say, hey, what are you doing? So this pilot as a process is to say, look, this is still a public process. This is still seeking engagement, but we are going to try something new and get that engagement in real time while it's ongoing. We used a lot of existing practices when we did this work. So we kind of set it up to look like a construction zone to be familiar to drivers. We used our parking enforcement staff who were typically giving street sweeping enforcement duties. They instead were enforcing the bus lane those mornings. And we also, an important piece of this is not expecting perfection. I think I see this a lot in plans and engineering design, is looking for trying to accommodate every possible thing that could go wrong. The reality is we had some curb alignments that didn't quite work. There was a curb extension that blocked the lane in one spot. There were other little things that we had to just live with. And that didn't take away from the benefits of the project. They were things that we could address later. There are things that we could, down the road deal with. But they were not seen as, impediments to doing a pilot. And this idea of perception is really important too, because a lot of the surveys we did, folks were telling us that they were saving a half hour, 20 minutes on their commute using this bus lane. And in fact, the time savings was more in this range of 3 to 5 minutes. But that perception of this being such a huge benefit really kind of gave us the tailwind to keep going and expand the program to move on to additional bus lanes. So how folks perceive what you're doing is very critical. So I'm going to leave it there. I know I only had 5 minutes here to talk. Here's my contact info. And I'm going to hand it over to Wes Edwards at the MBTA, who has sort of run with this in his time at the T and done quite a bit more work than I have across the region. So Wes, take it away.
Thanks, Jay. I appreciate that. Hello, everyone. My name is Wes Edwards. I'm the Deputy Chief of Operations Planning, Scheduling, and Strategy at the MBTA. And I know they're pulling up my presentation right now, but I think to give both Jay, Julia, and a number of advocates a lot of credit, the transit agency, when I first came here in 2017, we were watching a lot of the cities do this work. We weren't terribly active in sort of seeking out bus lanes, but we're sort of monitoring how those projects were moving forward. I think once we realized the boon that they were, the benefit derived from them, we really wanted to run with it, figure out like, how can we help more of these exist across our system? So that was where me and my team started to develop. It's like, how can we build a robust team and funding structure to really help move a lot of this forward? So happy to take the reins from Jay and sort of talk about how we started building out a program in the Boston region. And then also, how do we respond through this in the middle of the pandemic? So on my next slide, I'm going to kind of talk a little bit about the Boston region, just give some overview, because I realize a lot of you may not be familiar with exactly a lot of the details in Boston. So Boston's an old city, founded in 1630. We got about 700,000 people across the region, and the region kind of floods over. So there's lots more people not very far away. We are an old city, though. We have America's first subway system, America's first public park, America's first public school, America's first university. Boston, for America, it is a very old city. A lot of people come here, a lot of tourism. Also, we've been here a long time, and our roads are very, very challenging. We are not a grid by any means. Next slide. So about the MBTA. So this is our transit agency. We have about 200, we are one of the largest in the country. We have about 200 cities and towns, and largely that's within our commuter rail system, which kind of goes much beyond this map you can see on the screen. Our bus system serves about 50 cities and towns for context. We have about 1 million riders per day across all of our modes, including subway, bus, ferry, and commuter rail. Next slide. And I'm going to drill a little bit down onto more on the bus side. So the map you see on the left is really sort of our urban core for bus service. It's very hard to read. I don't expect you to understand that, but I just want to help you understand, like, none of our streets are squares. It's very complex, and there's actually much more bus service outside of what you can see in this map as well. Our bus system makes about 42% of our ridership. We're going to talk about, so that's about 300,000 daily riders. We have 5 bus rapid transit lines, 15 what we call frequent bus service, about 15 minutes or better throughout the day, 7 express routes that jump on the highways to get people where they need to go a little bit quicker, and then 125 either local or coverage routes across the system. Pretty expansive bus system. So I want to focus a little bit on sort of bus planning and our take on bus planning. So as many of you know, on rail systems, typically like transit agencies, they either like own the land that the rail operates, they like own the track, or they partner with it, and they know exactly what needs to happen there with switches and signals and everything else. Bus is very different. So we go to the next slide. So the MBTA, we operate the service on the city streets. The next slide. The challenge is, we don't own the signals, the curbs, the streets. We work with the municipalities for all of those different elements. So we realize that bus planning really is a partnership with the cities and towns. And just to clarify, the MBTA itself, we are technically a state agency operating across the Boston region. And then the cities and towns have full control over their own roadways, as well as some roadways that are also operated by state agencies. Next slide. So every project that we work on is a collaboration with the city. And then we have to think not just about the transit service, but what does this mean for parking? What does this mean for bikes? What does it mean for cars? What does it mean for our bus service? And all those different elements that are utilized by city streets. And so that's kind of the approach that we've brought to working with cities, is how can we work with them on sort of a a multimodal complete streets approach to thinking through how we improve transit service, but we can't ignore those other multimodal uses on the streets as well. Next slide. So my goal in 2018 was figure out how do I build a robust transit priority program at the MBTA, and sort of what are those steps that we can continue to support those 50 cities and towns in thinking through bus service. They had this great plan to like hire staff, build a toolkit, which is our how-to guide for how we're going to build these things and what streets should look like, identify where to build them, start asking for funding from different sources, engage the public through the process, and then start the construction process. Sounded great, started the process, started hiring staff. Next slide. And then the pandemic hit. And so we had to really rethink what we were doing. We couldn't actually move forward with the toolkit piece, and we deferred that. Identifying where to build, that process got also sidelined. Instead of asking for funding, suddenly we were told that we have funding, we need to figure out how to spend it because we're responding to an emergency. And so, but we just need to figure out exactly like what do we spend that money on, but money became not a problem. Engaging the public was very different during the pandemic. People were no longer out on the city streets. People were no longer driving. It was, we need to make sure that we're putting in bus lanes where they need to go. And the public engagement process looked vastly different, and it didn't exist like it does sort of before the pandemic and today. And we did continue to build bus priority. Next slide. So we built this sort of rapid response bus lane program throughout the pandemic. So we planned for 14 new miles of bus lane. We partnered with over seven municipalities to deliver bus lanes as fast as possible, including many cities and towns who had never done a bus lane. So this was really a first for them. And then we started exploring also new opportunities for bus lanes in places that we typically don't see them, like roundabouts. We rethought how we're focusing on, or where we're focusing on bus priority. We looked at where there's durable ridership during the pandemic. So this means places where we continue to see high ridership on transit, despite a lot of people leaving the system and not riding anymore during the pandemic. We looked at where we saw chronic delay before the pandemic, so we know those areas were definitely where we needed to focus. We also looked at crowding during the pandemic and what were our crowding levels, and implementing like GTFS measures for crowding across the system. As we all know, like everyone was trying to get as much space as possible, even on transit. So how can we give people more space even when they're riding a bus? And also looked at sort of our high environmental justice impact communities, and where can we put bus lanes in or bus priority to really start sort of improving those users' trips. And one of the lessons learned, to kind of allude to what Jay Monty said earlier, is we didn't really want to wait for perfect data. People were waiting to align, like, oh, we make sure the seasons are the same when we're measuring data, or the years are correct. But we already knew a lot of the information that we had, and some of it didn't quite align, or sometimes we had to use professional judgment, but we still had good enough data to start making decisions quickly and responding quickly. Next slide. So all of this, again, is a collaboration with our municipalities, the cities and towns, to really identify where those corridors were, identify where the opportunities were, whether there's sort of ongoing city projects that they had that they're maybe restriping their roads or tearing up their streets, and could we couple with those. Developer mitigation, whether like a new building was being built and they're going to change the sidewalks, could we actually have them do street work or signal work as well? And are there like diversions for if it close some of our rail service because they're doing work on the track? Can we make improvements on the surface and not only support those replacement shuttles for rail closures, but also help support existing bus services? The MBTA, we provided resources for the cities and towns to think through like redesigning their streets. We provided a lot of the contracts that were ready to go. We had consultants ready to jump in and start designing streets. We also provided resources, financial resources, paying for things like red paint sometimes, or maybe curve adjustments to make some of these projects feasible. And we really relied on those cities and towns for any of the public engagement. We would partner with the city to figure out who was best for managing the construction. Sometimes we would bring our teams in. We would manage construction if the city didn't have capacity. The city wanted to lead construction, we would let them do that as well. And throughout this process, we would often try to work on making agreements in place for making sure that who's paying for this, these bus lanes, who's maintaining them over time, who's constructing them, just to make sure that those are in place as well. Next slide. One of the pieces I want to highlight was we worked actually with the MAPC, where Julio's at now, to do a joint paint procurement. Because we have 50 cities and towns in our bus service area, and we're like 7 or over 7 cities we're trying to put bus lane paint in. Every city typically would have to go out for their own contract to get bus lane paint, and the cost of that actually would increase just given the small quantities. So we actually partnered together to with their 13 different cities and towns to reduce the cost of this paint and get a single contract in place that essentially could be activated overnight. Literally, you can call the phone, get a contractor out there the next day with paint. This reduced the cost by 60%, saved us $2 million in the first year that we were actually implementing our rapid response bus lane program. And there's also sort of made it just really easy for implementation. So they didn't have to go through the typical procurement contract process. We had gone through it for them, or the MAPC actually had gone through that for them so that they could activate very quickly. Next slide. And then so kind of highlighting a number of firsts that we implemented during the pandemic. So up in Everett and Sweetser Circle, we put a bus lane and a roundabout. It's the first bus lane and roundabout we've done in New England. I think it actually might be the first in the country. We'd also implemented our first center running bus lane. This is a project that we started before the pandemic, and we decided to accelerate it. And a number of new communities, Malden, Lynn, Chelsea, Revere, got their first bus lanes, as well as expanding more bus lanes throughout the region. We're really able to drive a lot more change as a result of a lot of the pandemic planning. Next slide. So kind of post-pandemic, we were able to go back and sort of think through like, what are those elements that we actually wanted to get back to building to really build the robust team? So now we're able to like think about building our toolkit, identifying where we want to build projects, start asking for funding, engaging the public in a meaningful way. Now that the pandemic is, for better or for worse, behind us. So the next slide. So we actually, on our website, you can visit us, mbta.com/project/bus transit priority. But we actually have a booklet that really guides through like what was our experience building bus lanes, what worked for us, what didn't, and a guide for the cities and towns, for consultants, for advocates, for the public to see what could be built on city streets, the different types of bus lanes and bus priority, and really kind of like the guide for how to do it or what you could do on your city street. Next slide. And to answer where to build, we actually went through and identified where is all of our existing high frequency service and actually future high frequency service, because we're going through a bus network redesign process now. And where would the most benefit from having bus priority across the system? So we mapped out where the existing bus priority is, where cities and towns already have a planning process underway, or the MBTA, and also where do we need new bus priority that it doesn't exist today, but we need to start those conversations to really build a robust, frequent network that can be reliable. Next slide. We also started really thinking through what are all the different funding sources with these elements in place that we should be going after. It was from our own agency to what do municipalities have for funding, to what does the state, the federal agencies have for funding, but also looking at like, what do developers have, and all the different mechanisms that you could go after those sources. So there's grants, there's going through the capital budgeting process for any of those agencies. Is there mitigation funding for developers in the cities they're building within those towns? Also, are there other projects that are ongoing, whether the city, the state, they're tearing up roadways, redoing sidewalks? We can try and couple some of the transit priority work with, try and deliver it quickly and more cost effectively. Next slide. And then also kind of building a robust engagement process. So now for every project, especially when we work with 50 different cities and towns, every community is different, but it's really assessing what does that community need and sort of what is the steps to go through that engagement process, and selecting sort of the right type of bus priority treatment to move forward, implementing, and then also following up with an evaluation of that process, and trying to repeat this process as much as possible, also recognizing that every community will be different. So how far did we go during the pandemic? So from 2003 to 2015, we had about, I'm going to use kilometers, 4.5 kilometers of bus lane in Boston. So we went about 12 years without increasing the bus lanes. So basically in the midst of our rapid response bus lane program, we went up to 28.5 kilometers of bus lanes delivered by November 2021. So really within that 6-year period, we ramped up quite a bit, almost 5 times the amount of bus lanes we had across the system, which is fantastic, and also to demonstrate the value to the region and the community and our riders. So just sort of what bus lanes could do to transform their commutes. And then next slide. Jumping to where we're at today, now we're at 67.6 kilometers of bus lanes. So we've over doubled where we were just 3 years ago. So it's really transformed the network, but we still have more work to do. If we go to the next slide. These are just our planned municipal collaborations for 2024 as we continue through the network, but we're going to continue chipping away at that bus priority vision map I shared earlier. This is just an example of what we have coming in the next year to keep delivering bus priority across the system. And then the next slide is the last slide. So just want to say thank you for everyone. At the end, we'll probably get to questions, but I'm going to pass it to Anne from Grayscale, who is also thinking about sort of one of our major projects that we've been thinking through the Boston region to deliver bus priority.
Thanks, Wes. Ilona, are you able to share slides? Hi, everybody. So as Wes mentioned, I'm really excited to share lessons from a corridor in Boston. It's a 3-mile stretch that has some of the highest ridership routes in the entire MBTA system. And it's, I think, really at the nexus of that identify where to build slide that Wes shared. So I'll be talking about the Blue Hill Avenue Transportation Action Plan, and specifically our team's attempt to put equitable engagement values to the test. So as others have mentioned, I work at Grayscale Collaborative. We are a Cambridge-based planning and design firm. For this work, we were contracted with the Boston Transportation Department's incredible team, although we were also working very closely with the MBTA Transit Priority team. Next slide. So I know everyone has, it seems, a different level of familiarity with Boston. So I'm going to talk a little bit about the communities that Blue Hill Avenue connects. So this project spans the neighborhoods of Mattapan, Dorchester, and Roxbury, which are some of the most diverse areas in all of the city of Boston. Up until the mid-20th century, Blue Hill Avenue actually had a streetcar running down the middle, but by the 1950s, during a period of mass migration out of the city, the streetcar was removed to speed up new suburbanites commutes into and out of downtown. And so today that decision has had lasting consequences, and there's been a relative lack of investment in maintenance and public spaces along Blue Hill Avenue ever since. And today it's really a car-centric corridor that encourages driving for those who can. As you can see on the map, with no subways close by, buses are really the public transit lifeline for these communities. Next slide. So this slide covers some of the safety and equity issues along Blue Hill Ave. As I've mentioned, buses along this corridor carry more public transit riders each day than any individual branch of the MBTA's Green Line. And more than half of rush hour travelers are on a bus. But still, these bus riders experience severe delays each week. And this is part of the reason why Black bus riders spend an extra 64 hours per year on MBTA buses compared to white passengers. For many residents, they don't have the option of traveling by car, even if it is faster. In one neighborhood along Blue Hill Avenue, almost half of households lack access to a car. And for those who can't afford a car, sometimes the driving that you see along Blue Hill Avenue is reckless. And unfortunately, this is on the city's high crash network. Next slide. So for many years, the city of Boston had a proposal for a transformation of Blue Hill Avenue that included bus priority, safety improvements, and greenery expansion. But as I've mentioned, the history of transportation injustice that I've covered on the previous slides has really led to an overwhelming lack of trust for many people in the city's intentions and in planning processes in general. So for this process, we work very closely with the transportation department to think about how we might do things differently. And to start, we structured a process where we put engagement and partnership building before design, and we built a very interdisciplinary project team that was capable of supporting holistic planning and collaboration. Next slide. And ultimately, through this 20-month process, we connected with thousands of people. To do this, we really focused on making it easy for people to engage. So we did the traditional large public meetings, but mostly we focused on making it comfortable for people to meet with us and for us to connect with them. We met with people at libraries and bus stops along the 28 route. We met with small businesses along the corridor, and we did a lot of this through a partnership with Livable Streets Alliance, which is a great advocacy organization based in Boston. And all of this work and all of these partnerships really allowed us to reach out to young people, bus riders, and bus operators. And these are really people who they're typically not going to be the ones that show up at the large public meetings, even though they'll be deeply impacted by the decisions that are made. Next slide. I think that for many people who are planners in the room, you'll know that engagement is really more art than science. But despite that fact, we were often asked, what % of people support a bus lane? What % of people support a bike lane? But the problem is that equitable engagement is just not as simple as doing a poll, and also that transportation planning is more than just bus lane or not. So for Blue Hill Avenue, we really tried to capture a fuller view of how people see their neighborhoods today and how they hope to see it and how they hope to live in it in the future. One of the engagement methods that we deployed were called Real Talk Conversations. And we were really able to unpack the range of desires that people had in these hour-long conversations of no more than 10 people, some of which were hosted by our team and some of which were hosted by a team of trained community facilitators, hosting them in English and in Spanish. Next slide. So you can scan the QR code here to listen to some of those conversations. And from that, you'll see how our goal for this project was never 100% consensus, which is in many ways not possible. Our goals really instead focused on transparency and capacity building, because these were things that the city and the T could actually commit to and act on. So for example, Kirsty Hostetter, who was the city's project manager, and for many people, the public face of this project, from the beginning stated that the city of Austin had a preference for a multimodal design approach. And she made that extremely clear in all public communications from the beginning. In addition to that kind of transparency on what the city's preferences were, that it also extended to decision-making, to funding, and to how we were collecting data and how we were analyzing data. And I say data analysis because we actually folded in our Real Talk facilitators into the analysis process, and the framework that appears on this website and in our final community engagement report comes out of this interactive community coding workshop that we hosted, where we listened to the conversations together. We looked at a set of themes and validated the main takeaways that would then show up and be presented to the city and to the team. Next slide. So as I mentioned, for this process, we focused on bringing community into these decision points that typically only involve public officials or consultants. And I'd say that listening to young people and low-income families and others who are typically underheard in planning processes was really crucial for the city's overall goals, actually, of addressing issues of equity, resilience, and affordability. And I'm nearing the end of my slides, but before I do so, I just want to introduce a couple of community members that we spoke with during this process. And the first is Daryl, who is one of the young people that we talked to.
So, kind of hearing like people want a lot of change, like something new, like new buses and stuff. And, like it's just like a lot of change. People are just tired of seeing like the old same thing over and over again.
And the next is Suzanne.
Neighborhood. I don't have a car, and so it's very important to have access to buses and be able to go someplace nearby where you can buy your food. People with low incomes, they have small children. I don't have a car, like I said, and just having the supermarkets in your neighborhood and access to fresh foods and low prices and everything like that is just so important, and it's really a necessity in the community.
Next slide, please. So actually just 2 weeks ago, the Wu administration in partnership with the MBTA announced a $44 million investment to redesign Blue Hill Avenue in order to better serve bus riders and pedestrians, to address safety concerns, to increase the tree canopy, and to provide greater amenities for small businesses and all those who live around Blue Hill Ave. So that means that this process is going to continue on and move into design. It's actually going to be led now by the MBTA, though still in partnership with the city. And I'll add that the project is also continuing to focus on the other elements that make up a complete community. So for example, we're actually working with Julia's team at MAPC to study and understand displacement risks in this area, how this project may impact those risks, and also how the city can appropriately respond. Next slide. So I'll just round out with some closing thoughts. The first being that context really matters. And whenever you start a public process, I think people will be familiar with this idea that, you should really expect that broader issues will show up. Even if you're there just to talk about transportation, you might get a lot more than that if you're showing up in a public forum. And so for that reason, it's really crucial that teams know the history of the places in which they're working, that they share this information for people who may be unaware, but importantly, that they keep this in mind as they encounter a broad swath of community opinions. The second thought is that documentation really matters. It is really crucial to not only listen to, but also document the voices of the intended beneficiaries of an infrastructure project. So not just cede to the loudest voices in the room, which can often happen. And the final statement is something that actually comes from the city and from the MBTA team that I worked with. The idea that transportation is primarily a connector that connects people with family, friends, and their broader communities. Something that's very personal because it determines the opportunities and resources that you have access to. And at the end of the day, that's why it is so important to think thoughtfully about the mechanics of who you are connecting with in the planning process. And I think that's my final slide.
Thank you so much, Anne. I love ending on that note of transportation being a connector. We often say, transportation is ultimately a means to many ends. It's not an end in itself. And we really see that playing out in all these projects, and particularly when you do a public engagement process and people are bringing up things like, actually, I can't get to the grocery store. Actually, it's like I'm having a hard time with childcare. It's like transportation is that linchpin issue that allows those needs to be met. So without editorializing too much in this conversation, we have about 10-15 minutes for questions. Thank you to all of our speakers and folks who have put questions in the Q&A box. Since we have a good lineup of them, I'll just go ahead and pick a few and get through as many as we can, but feel free to continue adding to the Q&A box. So our first question came in a little while ago for Jay regarding the pop-up bus lanes. The question is, was there any pushback on A, allocating budget to this kind of non-traditional planning and intervention, and B, the validity of doing it instead of traditional planning?
So part one on the budget side, one thing I didn't talk about in my presentation was governance and how municipalities are governed. And it actually varies quite a bit across Massachusetts and even across the Boston region. In Everett, we have what's called a strong mayor system of government. It's kind of like having a president, right, who can make executive decisions, who submits a budget. Our city council, will approve the overall budget, but the mayor and the administration have the discretion of how to spend, with limits that those funds. So from a budget perspective, number one, we didn't spend a whole lot of money, right? So it was staff time, staff who were already on shift in most cases. It was paint at the end of the day when we finally painted it. But it was really a very low budget project. When we came back and sort of upgraded things, Wes mentioned the bus lanes and the rotary. We obviously sought funding assistance from the T to do that project. So as we've sort of grown, we've gone after grant funding opportunities, partnerships with other agencies to help us fund those things. And like I said, perception, right? Once we sort of got over that initial perception hurdle, those things became a lot easier to get. It became much easier to put a line item in the budget to maintain and expand bus lanes in the city. Became much easier to go to the T or to MassDOT and say, hey, we need some money to do an expansion. So budget was never really an issue for us. I think, certainly a larger project it could be, but for us, we really navigated it on a shoestring. And the second question, could you remind me the second question, Julia?
The validity of doing this type of non-traditional planning instead of traditional, evening public meetings, 6 o'clock. Yeah.
So I guess two parts to that. One is I mentioned the initial study, the transit action plan that we did with Mass DOT, and that did include a lot of traditional outreach in a general sense, right? It didn't specifically say on Broadway, how do folks feel about a bus lane, right? But it did talk about prioritizing transit on city streets. It talked about changing routes. It talked about infrastructure investments. So we felt that was a good enough baseline to do our pilot project. But like I said, I think I personally was nervous, and I mentioned that first talk I gave using almost this exact same slide set to a room of advocates who were very passionate about the traditional sort of outreach process, and I had to go in there and say, look, we didn't do it. We didn't do it the way that we've always done it. But I think there's a recognition that that traditional process has a place, but it's not a one size fits all. And if we over focus on process to the point that it delays action, we are, in our view, creating an undue harm by basically our inaction, right? So we have to, a good plan, like I said earlier, is one that produces a positive action. So we felt that the pilot combined with the previous outreach reflected, enough of the traditional type of outreach, but also the need to get something done and on the street, so that plan didn't sit on a shelf, and we didn't just continue that harm of disinvestment, right? But it was a trick. It was a tricky to kind of communicate that early on. I think we've since been validated by that pilot process. We wouldn't use it everywhere, right? We wouldn't use it. We wouldn't go digging up the street and resetting curb for a pilot process, right? We do it for things that can be reversed if they don't work out, and that's an important point.
Yeah, actually, I want to pick up on that, since we just heard two very dramatically different processes that could seem to counteract one another, and we're seeing some of this in the chat. But just to ask, this would be a question for Anne, based on the whole process that you helped lead the last couple of years of Blue Hill Ave is in stark contrast to the process in Everett, or some would say lack of process. The pilot is the process. What's your take on, the merits of what you helped to lead in Boston on Blue Hill Ave versus, with a lot of meetings, a lot of different touch points, without that let's just try it method that Everett sort of championed? Where do you see the risks, the opportunities between the two different approaches?
Yeah, I think that, Everett is not that far from Blue Hill Avenue, but to Jay's point, the governance of the city, as well as the relationship between the city and various community actors, is not the same. So I think that the process we structured was very important for this area. Would we have done this for a 3-mile stretch in a different neighborhood in Boston? Maybe not. This project, though, had a history of, it actually had, with a different project manager, they had advanced a process in 2019 that the city decided had to be put on pause during the pandemic because of the inability to continue engagement. I think that then when we picked it up, we were in many ways starting from scratch because it was really important for the city to be able to not only come up with a realistic and thoughtful concept design, but to have some sort of public consensus for this project. And I think that because this was a new way of engaging, it was definitely a far more built out way of engaging than the transportation department had ever worked with. Not everything was a success. I think that there were definitely lessons learned on how we might allocate our time and our resources if we had the chance to do it in a different area. But for the information that we had and the kind of political calculus involved, I do think that it was necessary to invest in this level of relationship building and decision making.
And I don't think those two things are in conflict, right? I mean, this is the Blue Hill Ave project is moving, infrastructure. It's 40 some odd million dollars, right? I don't think in Everett we would do a $40 million project as a pilot, right?
The cones you dropped weren't $40 million.
Yeah,
DPW, police enforcement, yeah.
sure. So I don't think the two are in any way in conflict, and I think there's other examples in the city of Boston where they used the pilot as a process method.
Right. We really built on that.
And they built on that. And there's projects like this that are major infrastructure that do require a significant, outreach effort. So in my view, not in conflict at all.
Yeah, really different magnitudes of projects. So this question I think would probably be for Wes, although I'm sure Jay could speak to it as well. How's the question is about impacts on vehicular traffic. How is the auto level of service after implementation of permanent bus lanes?
Yeah, I mean, every quarter is going to be different. It's something we always look at. We often look at before projects go in to understand what is the traffic today and what do we think there's capacity on the road. But there's also, I think, a couple somewhat philosophical questions that we even have to ask our leadership. I've often heard that traffic is so bad that we can't fit a bus lane in. At the same time, I often hear there's not enough congestion to warrant a bus lane going there. And I think it's you can't have it both ways. And when is the right time to have a bus lane? So I think there's a couple different perspectives when you think about this. One is you can measure traffic, you can measure the transit throughput and the passenger throughput, and then measure it afterwards. But at the same time, there's also a policy conversation with leadership of what is the vision for the future of transportation in your region, and what does that mean from an environmental perspective, from a sustainability perspective, from an access and an equity perspective. And transit starts to tick a lot of those boxes, and you start to have the conversation in that framework. And it also helps negate some of that conversation about congestion is going to be so bad. Lastly, I'll say when we have looked at congestion impacts afterwards in different corridors, there is a kind of a classic like traffic engineer perspective that the traffic must go somewhere. So where does it go? And actually what we're seeing is sometimes it actually evaporates, right? When we measure it, people change the time of day, they change the mode that they're on, people decide not to take trips. And we see improvements in transit up to like a 15% reduction in traffic that we don't even know where it goes in some cases. So we're starting to actually do some measurements around what is actually the traffic like evaporation look like when we're implementing a lot of these projects, because we're not seeing it necessarily just go somewhere, we're seeing it just disappear in many cases.
That's a great point that I think lends strength to the next part of this webinar series is just really looking at just shifting demand and behavior changes and how things like art and overall experience and wayfinding and things you wouldn't normally think as being key to the attractiveness of transit that actually can make a big difference, not just making the bus run more quickly and reliably, but also just making it more fun, making it beautiful, giving people a greater sense of dignity. And that's something that we've also seen in and around Boston by way of the Boston BRT initiative and other creative projects that have taken shape to just take a different approach to how we do transit planning, from being able to do things quickly to really digging in deep and talking to people where they are, to adding beautiful things like art and flowers and signs in multiple languages that makes the system seem like it is for people and it works and it's a good choice. And then you can start to see that evaporation that Wes mentions. Maybe that's where it goes. People are just getting on the bus because of these other elements. So we have a lot of questions in the questions that we didn't get to. There's 2 more minutes. I will defer to you on how we should use these last minute at this point.
Julia, if you want to ask for some closing remarks or one quick question with like 1 sentence answer, we can fit 1 more.
How about I'll ask you closing remarks. It's hard for me to pick and choose these questions that could all be asked to any of them. So just if either of our speakers want to just add a couple of things to wrap us up and set us on our way, we'll wrap up that way. Any closing remarks?
Jay, you're on mute.
Oh, sorry.
No, yes, I see your lips moving.
No, I think, well, there's 3 of us here from 3 unique perspectives, 3 unique initiatives and projects that have all spoken to each other in sort of different ways. And maybe the lesson from that is look, everything is very context specific, right? What works in Everett might work somewhere else, but it may not. And it might depend on your system of governance. It may depend on your constituents and the history of those neighborhoods. And you know, Dorchester and Roxbury and Boston have very different history over the past 50 years than Everett did. And so they are going to require a very different type of outreach and process. But at the end of the day, I think the important thing that, I feel out of all this is that, we're all here to hopefully improve the lives of our constituents and doing so through better mobility. And I think as long as we keep that as our kind of driving force, you'll find the right context and the right way to move your project forward.
Great, Jay. I think for me, my kind of closing remark is I think one of the ways that we really drove success across the region is no one is going to tell your story for you. You need to tell your own story. And we started out small. We had cones and bus lanes, setting those up, and they got good publicity around them. And we started doing more of that. And then we started taking lanes of road and saying like, oh, let's convert this to a bus lane and try our first like roadway conversion. And then we started building center on bus lanes. And the entire time we were working with advocates, with the media, getting our own press releases out, finding honestly, what are the one-liners to really sell that this is like a really dramatic change in people's lives. So now we're talking about center running bus lanes across our region, where only 8 years ago we were just trying it with cones. Someone has to tell the story, and it has to be the implementing agencies to advocate for that.
I think, just to refer back to things that Jay and Wes have said, I think Jay mentioned that perception is as important as reality. He gave a positive example, but, goes the other way around. So I think Wes's point about telling your story and also making sure that the stories of all the people that you talk to in your day-to-day, in those public meetings, in those engagement events, that there's a way of tracking that and documenting that as well is incredibly important for these large-scale projects. And I'll just say I'm really heartened by the work that you all have shared today and all the tools that planners have to have in their toolbox to create better, healthier, and more connected communities.
Everyone. Yeah, the data is only as good as its communications. There are a lot of questions came in about communications, and I hope that was something we were able to elevate here and recognizing people's perception and lived experience, and juxtaposing that with the data and make sure that they speak to one another and are delivered. It was a key part of all these projects. So we're a couple minutes over. If you want to wrap us up, I'm really happy to have been a part of this conversation, to have been a part of this work with all three of you on the screen. And it's great to be able to tell these stories. And I'm looking forward to the next webinar in this series.
Great. Thank you so much, Julia. And thank you so much, everyone in this panel, Wes, Jay, and Anne, for sharing your time. Obviously, the audience for joining today and being active in the chat. So as Julia mentioned, we'll again meet for the final installment on April 10th at noon Eastern time. Link to register is in the chat. And I also have an exciting news about the anticipated launch of the 2024 edition of the BRT standard later this month. Please stay tuned for the announcements. This is a flagship publication since 2012. It has been providing framework for understanding BRT and an evaluation tool for BRT corridors. We're planning a webinar that will celebrate this launch and look into the new features for BRT design to be more inclusive and resilient. So again, stay tuned, but the link to register is already in the chat. And with that, I really want to thank you all again and see you in several weeks for the final session. Thank you all.
So much.
Thanks, everyone.
Care.
Bye-bye.